Now there's a lot of places you can go to get some mentoring. You can even go online. And this is from the horse's mouth. So if you want some mentoring, you can get it online. So you go on this website and you type in, I've had problems with my credit cards, and it'll tell you how to take care of your credit cards. But there's a more direct way to do that. And what I'll share with you in a minute is really my motivation for being a mentor. So there's something that motivates you to do it. And then there's something that is characteristic of a mentor. And then I'll talk about some of the functions of a mentor. And as you heard from Shireen, I grew up in Colorado, and Colorado is a wonderful place. And if any of you have been there or skiers, this is Maroon Bells, and it just sits outside of Aspen. And I didn't see it till late in life. And given my age, there was Life magazine was around at that time. And Life magazine always had these wonderful ads that showed Marlboro, and that showed these mountains. And I didn't see them until probably when I was 20. And it sits outside of Aspen, and it was created by the collision of these tectonic plates that formed our Earth. And there's some volcanoes to the north which formed Yellowstone, and farther south, I can tell I've been hanging out with my grandchildren, and farther south in New Mexico. And these were eventually formed by glaciers, and these are some of the most difficult mountains to climb and very dangerous because of the very loose granite. Part of as those tectonic plates hit each other, they popped all over each other, and they formed these thrust faults. And you'll see one. I don't know how many of you guys are skiers, but I'm still a skier, so you fly out to Denver and you get a rental car at the airport and you get on I-70 and you head up to the mountains. And you're going about 70 and you're starting to make the first climb into the mountains, and it says, point of geologic interest here, but you're going so fast you can't turn off, you just keep going. But there's one of these things, and it's where the Earth is sort of buckled and thrown up the mantle of the Earth. And there was one not far from where I lived, and after the summer runoff, you'd go there and you'd find seashells of an ancient seabed, fossils. And I don't know how many of you watch South Park, but South Park's that sort of vulgar, cartoon that's placed in South Park, Colorado. South Park, Colorado is actually an ancient seabed that sits there. So it was in these environments that what became important really in my life was relationships, whether it was relationships with your Lord or, with the earth, or whether it was with people. And actually, mentoring is really all about relationships. And this relationship is special in that you give to this other individual something that's beneficial to their life without any expectation of reward. And that return is part of an altruistic nature that I think all of us share in this room. Because why are you in academic medicine? Because obviously you could be in another environment in which the rewards are greater, the monetary rewards. When in fact what we feel as academic physicians is an intangible reward that is not easily compensated by dollars. In some cases it is in this environment, but not always. And so we've all made a sacrifice to be here. We all feel that we want to leave the world in a better place. And the way to do that is to create and train young anesthesiologists or vascular surgeons. Now, so that's sort of my motivation for being a mentor. Now, the second part of it, what is a mentor? And these are a number of individuals that I think are probably pretty good mentors. I've always carried with me the saying that would you follow that individual into the jungle? And I always thought that that was in some way related to the Vietnam War, that you would go into the jungle with your platoon and that you would count on the other individuals either not to shoot you or be shot so that you get out and survive it. Well, that term actually applies to the guy up on the far right. His name is Selby. If you Googled it, he was a young soldier in the Australian Army, and he was marooned on Papua New Guinea. And he was attacked by much superior force and took his men into the jungle, literally. And through this experience, he wrote a book called Hell and High Fever, but it was the demonstration of loyalty and trust amongst these individuals that they had a central core to them that the whole group would survive and prosper. And I think Shackleton is another example of the same thing, where he took these men on the endurance through a very dangerous thing, and he made a personal sacrifice to go back to save his men on Elephant Island. And the final example is probably Dante and Virgil. And Dante chose Virgil, a person much earlier than he, to be his guide through purgatory. And so you'd say, well, these are pretty extreme examples of what we do in a daily life. But I'll tell you though, if you're a young individual and you have to do a big case in the operating room and you have all the perils of bleeding and death and retribution and standing up in M&M, and it's the same with you guys, with your junior faculty or residents, you know, you have to put them in with one of my partners who yells and screams at them. I mean, those are probably just as bad as purgatory or any other place. So there is this bond that forms between these individuals that we're going to get through this process, whatever it is, and we're going to come out on the other side and we're going to be okay. The other part about being a good mentor is Blink. This book, and many of you may have read it, but it talks about first impressions and it talks about subconscious processing of information in a very, very rapid fashion. And industry and big corporations have a very good mentoring program where they really plan for succession of their junior people to take over leadership. And I think they think by putting two people together, there's a transfer of some ineffable thing from one individual to another, some sort of magic sort of quantum thing that leaps from one person to another. And I think perhaps that's true, and I call it in our world surgical intuition. So when you make rounds on a patient, there is something that you look at that patient and for the 20 years that you've been at the bedside, for whatever reason, you can understand that there's something not quite right with that patient. And you don't know that the lights are okay, the O2 is okay, whatever's okay, but you sense something is wrong. And I think that's true with your faculty here, your senior faculty, when they're in the operating room, you know, when the person gets a blood transfusion and they don't look quite right, you know, you have that sense. And that's part of what you pass on to the people below you, is that sort of inquantifiable experience to the younger individual. And the final part of this first part of my talk is to talk about a social contagion, which is really to pay forward. And Jimmy Yao was my mentor, and I've had a number of really good mentors, and most of them are named Jim, like Jim Hines and Jim Webster, and David Green sort of falls out of that character. And so you can have mentors within your own group, but you can have them outside in medicine as well. So it's really paying it forward. So Jim is a very good mentor to me, and now I'm mentors to my own faculty, many of whom you know, whether it's Jeff Motz or Mark Esconderi or Melina. Haron was one of our faculty, and he wasn't in this picture, and Dr. Rash came a little bit later, but he trained elsewhere. So it's really paying it forward and not paying it backward. Now, this is the academic ladder, and if you look at the guy at the very top up there, that's probably me. You know, on a weekend, I'm usually doing something in my house, and I'm way up on that thing, and the guy looks relatively old up there too. So you're standing at the top of this academic ladder, looking backwards, because you've had to climb. You know, you got out of med school, then you're a resident, then you got out of residency, and then you're a fellow, and then you got out of fellow, and then you were junior faculty, and you sort of went up that ladder. And so that's all about these young faculty members trying to make it up that ladder without falling off it, but your job's to help it. And sometimes you can help one layer below you or two layers below you. Sometimes even you can be mentored by a junior faculty to me, so I'm mentored in reverse, so that it all sort of works. And the reason I'm at the top of that slide is if you notice that all the buildings that many of us trained in are gone. So I was walking on the bridge on the way over here, and that's the VA here in a postcard. I don't know why they'd ever make a postcard of the VA hospital. it's halfway down too, so that's why I'm this old guy at the top there looking down. So when I gave this talk at this academic society, the question that was posed to me is how do you evaluate an offer? So I'm going to take that same talk and sort of reverse it away. And what I ask is, will you be given the chance to succeed when you go to this new institution, so when you look at a job? So the contrary is true for you as mentors, is are you going to give the individual below you the chance to succeed? And you'll notice in some academic surgical divisions, you'll see that there is a dominant individual and nobody else below him, and that those people rotate in and out very quickly. And so you can understand that that person is not passing the stuff down. And you can see it in the other divisions. You can see that there's a dominant person that seems to suck all the resources, and it's really clear in vascular surgery, you can follow people around the country, that they seem to stay in that position and don't allow the individuals below them to flourish.